Hi, thanks for joining us. I'm Patty Teal, and today's guest on the Senior Helper Show is going to be Dr. Splettstoesser, a great podiatrist in Santa Barbara. Come on, join us. So, Dr. Splettstoesser, how can people remember your name?
The way I usually explain how to remember my name is to break it down. And the first part is Spletts, and then it has T-O-E-S in it, Toes-er. So I usually say hello to my friend here, and I hold this up and I just say, think of a podiatrist with split toes. That usually works pretty well.
So, Dr. Splettstoesser, what are the most common foot problems?
One of the very most common is ingrown toenails. And essentially, one of the ways to prevent having to see me in the first place before the toe is totally infected and painful and pus is coming out is to not do what our parents told us in terms of cutting the nail straight across, but instead consider just trimming back the nail, curve it back slightly. You don't want to make a real sharp acute angle because people will hit the quick of the nail, the skin underneath and the nerves. They'll try to pull it out, and invariably they'll leave a sharp point in there that continues to grow. And if that occurs, it's going to be impossible for them to rectify it, and then they will end up in the office here. And it's so much easier to take care of it earlier than waiting till it becomes like this, because if it is really red and inflamed, then I've got to place them back, put a screen up in front, spray a cold spray on this area, and remove the offending portion of the nail. We try to remove as little as possible, just a small sliver. However, we have to then have them come back in about 3 weeks, 2 to 3 weeks. They have to soak it twice a day in Epsom salts. They may be placed on an antibiotic. I have to take a culture and sensitivity, and it's a very expensive proposition. If they can just come in earlier, then I can explain to them how they can possibly have themselves address it, or their children, or their husband. And luckily, the Medicare program will allow a patient to visit a podiatrist every 60 days for routine foot care to prevent any of the possible conditions occurring. If there's pain, however, the patient will be able to come in right away. But once again, every 60 days, a patient is entitled to come in to see a podiatrist. And it's very important, especially if they're a diabetic, or if they're a smoker or a past smoker, or if they've got any, if their immune system is compromised, if they've got Raynaud's phenomenon, if they have congestive heart failure and they have a lot of swelling around their ankles, it's imperative that they consider seeing a podiatrist. Another common entity that we see, Patty, is dealing with corns and calluses. A patient can be their own podiatrist at home by simply taking a pumice stone and just buffing down the corns and calluses. Technically, and thank God, Medicare looks at a callus as the first stage of an ulcer. So once again, in terms of prevention, if a person can at least get the guidance from a podiatrist or a dermatologist and be aware of what can be done on a preventative basis, it is going to make life a lot easier for them. There is, luckily under the Medicare program, a person can come in as often as they want to if they have any type of inflamed, painful corn or callus. There are a number of over-the-counter pads that can be utilized from your local pharmacist, your local pharmacy rather, and there are a number of over-the-counter inserts that can cushion the ball of the foot, and if that helps, great. If the callus continues to get worse, however, there are special custom fabricated orthotics that can be utilized to offload a deep-seated callus that is either painful or has an opening to it in which there is drainage. And usually the drainage is infected, and in order to heal that, we are able to choose from about 34 different types of orthotics.
So, Dr. Splettstoesser, I'm curious, are bunions inherited, or is it because we wore our shoes too tight?
It's usually primarily due to the inheritance. However, if one combines that with shoes that are too tight, too narrow, or the heel is too high, it can aggravate that and speed up the whole process of the bunion forming, which essentially is a buckling or a dislocation of that joint. The worst cases that I've been exposed to are those cases in which both the father and the mother have bunions. It's almost like diabetes. 75% of all diabetic children have their mother and father are both diabetics. For feet, it is the same scenario. If both parents have a history of having bunions, it's very likely that the child at the age of kindergarten, certainly by the age of the 7th or 8th grade, 12, 13, 14 years old, is going to be in the early stages of developing a bunion. And there's a term called actually juvenile bunions, in which the joint has dislocated to the point of being a major problem. We can prevent the bunions from forming in the first place by utilizing orthotics. And orthotics are a device that slips in the shoe. Most people these days are fully aware of what orthotics are, and they help to stabilize the foot and prevent the foot from excessively pronating or excessively flattening out. There's actually 21 steps that follow the foot having a tendency to flatten out. I'm not going to cover all the technical, biomechanical, and structural steps that ultimately cause a nice straight alignment like this to turn into that. Here at the office, we try to educate the patient as to what they can do themselves to stay out of this office and stay out of trouble.